My patient asked me at what age does their child need orthodontic treatment or braces? What's the best age to get braces for a child? I'm Dr. Maryam Horiyat at Arya Dental, a holistic, biological integrative dental office in South Orange County of California. Well, there are mainly two approaches for orthodontics or braces for children. Number one, two-stage orthodontic treatment, which is phase 1 plus phase 2. Number 2 is a one-stage orthodontic treatment. It can be limited or comprehensive. What's the difference between two-stage versus one-stage orthodontic treatment? Two-stage orthodontic treatments include phase 1 and phase 2. Phase 1 orthodontic treatment, also known as early growth guidance or interceptive treatment, start at young age, between the age of 6 to 10, when a child has mixed dentition, or a mixture of a baby and permanent teeth, followed by phase 2 orthodontic treatment, which starts usually during the early adolescence years. Phase 1 is performed to address a functional or skeletal issues and allows us to guide the proper jaw and skeletal growth at a younger age. Phase 1 is not necessary for aligning teeth or finishing and detailing. Phase 1 is recommended when there is a skeletal issue present in a child, and delaying correction will increase the risk of further skeletal growth and airway issue in the future. In phase 1, we utilize the growth of a child so we can intervene earlier to get the result faster, shorten the total time that a child is in orthodontic care, and reduce the need for jaw surgical cases and extractions of permanent teeth. After completion of phase 1, during early adolescence years, we usually start phase 2 braces. During phase 2 braces, teeth are aligned for maximum static, function, and stability with braces and specialized retainers. One-stage orthodontic treatment, which involves just one stage of treatment in contrast to two phases orthodontics, can be at any age after all permanent teeth are erupted. One-stage braces can be either comprehensive or limited. Limited treatment will focus on the single tooth or single group of teeth, whereas a comprehensive treatment would involve idealizing the bite, smile, alignment of all teeth, and soft tissue aesthetics. For children, comprehensive treatment is the most common form of treatment. One-stage comprehensive treatment is only recommended for children in the absence of skeletal and growth issues. How do you know if your child needs phase 1 orthodontic treatment? We suggest you bring your kids to the dentist or orthodontist by the time they are 7 years old, because around age of 6 or 7, a child transitions from 20 smaller baby teeth to 32 larger adult teeth. Before your kids start getting adult teeth, you want to ensure that their jaw and teeth are growing correctly. Why is it so important to evaluate a child for orthodontic treatment around the age of 6 to 7? Well, each child has 3 different ages in orthodontics. Number 1, skeletal age. Number 2, chronological age. Number 3, dental age. Skeletal or bone age is defined by the age expressed in the years that corresponds to the level of biological and structural maturations of bones. This age is related to puberty and growth. Chronological age or actual age is calculated from the date of birth. Dental age is a measure of dental growth based on the number of permanent teeth erupted in the mouth. Skeletal and dental age has been used to determine a child's growth and biological and structural maturity. Chronological age is not very precise for evaluating a child orthodontically, especially in girls that reach puberty and growth at an early age. For example, a girl can be only 8 years old, but they already got puberty and her skeletal growth is almost completed. But their teeth eruption might be delayed and only have a teeth eruptions of 7 years old. That is why chronological age is not very precise for braces treatment planning. Now the question is, how do we evaluate your child's skeletal and dental age? X-rays of the hands and wrists and cephalometric X-rays are the most common modality used to calculate bone or skeletal age. A panoramic X-ray is the most common way to evaluate dental age. To prevent extraction of permanent teeth, surgical treatment, or compromised airways, your child might need phase 1 orthodontic treatment. The following can be the common growth issue that may need early phase 1 orthodontic interventions. Number 1, crowding. Narrow arches and deep palate can cause developing teeth to get stuck and not be able to erupt properly. Number 2, crossbite. In the crossbite, either upper jaw is too small or the lower jaw is too long. Crossbite may cause permanent teeth chipping, sensitivity, uneven wear to the enamel. Besides, if your teeth do not close in an aligned bite, the muscles on your face might not be equally engaged, causing neck pain and even headaches. Crossbite also affects the facial features and profile of your child. Number 3, overbite, also known as a deep bite, is when the upper front teeth overlap the lower front teeth too much. This type of bite can cause excessive wear of the front teeth and prevent the lower jaw from growing forward. Number 4, underbite or anterior crossbite is when upper teeth are stuck in the lower teeth. This can cause the front teeth to wear down too early, and if it is left untreated, it may require jaw surgery to correct it later. Number 5, excessive overjet. The upper front teeth stick out or protrude too far in the front of lower front teeth. If the overjet is too large, the upper teeth are more prone to fracture or trauma. Number 6, open bite. An open bite is when the front teeth do not touch. This makes biting food on the front teeth almost impossible. The back teeth can wear down permanently because they must do extra work. This kind of a bite sometimes causes speech problems and tongue thrusting while swallowing food. I hope you find this video very helpful. Please don't forget to like and subscribe to our weekly videos for your oral health.